Hi guys, Web Equity here, featuring a story with a timeline to talk about one side of the COVID-19 pandemic crisis. Now, first thing I will say is I understand this is a very bad sick flu and people are dying. Some people are more vulnerable than others, and it's a serious, serious flu, but just know that every single year there is a serious flu. So it is just a flu. It only shows such high numbers because all the hospitals were forced to check the box for covered death, even when that patient showed up with many other symptoms or diseases or illnesses. They did this because they got paid extra for each person that died of COVID-19. So basically, all the hospitals had to do was mark the COVID-19 death, even though if someone came in with a horrible heart pain or side effect or diabetes or something else. And when anyone passed away, they were tested for COVID-19, all of them, in and out of the hospital, which is why the numbers are so high. So as the nominal flu comes each year, and people were in and out of the hospital, so most of the people in this hospital caught some instance of COVID-19 while they were in it. So that box was checked when they passed away. Someone has heart pain from a heart condition, goes to the emergency room, catches the COVID-19 bug while in there, then dies for their heart condition. At some point, they get the test for COVID-19 and the hospital shows they had it, and it may be a contributing cause of their death, so the hospital gets paid an extra stipend for that COVID-19 death. That's just a fact. Another fact is the CDC came out and said that 94% of deaths had other boxes checked. That's on their website. Please check it, which means we cannot exactly say whether they died of COVID-19. If you team that up with the standard margin of error across this medical industry, you come with the fact that the flu is just as bad or deadly as last year's flu and SARS and H1N1 and Ebola. In fact, every 2 years there is a much more serious version of that flu that changes and adapts each year. The flu shot that we take every year is actually healing last year's flu. People die from the flu across the world every year. The main difference between COVID-19 and other diseases is technically COVID-19 is proven to stay on surfaces longer, meaning that the real mitigant and to risk of COVID-19 is hand sanitizer, cleaning surfaces, washing your hands, because everybody is going to touch it in one instance throughout the day. And this disease was actually proven to travel more than 1 or 2 inches like other flu, but that it would reach 5 times that length to spread, meaning that another solution was simply to stay distant, wash our hands, which is what careful people do in every flu season. If you're an at-risk patient, then be careful. The lockdown, as it stands, does not mitigate against it. People are still around each other. It could be jumping from my arm to another arm, from surface we touch. We don't need a mask to cover our mouth. The COVID germ lives on our skin. So it's hopping around everywhere as we're walking and talking. This is why face masks did not stop the spread, period. And it were really scary if an airborne disease, people would be dropping in the streets. Given that it spreads so easily and stays around so much longer, we are bound to see higher numbers. And like I said, people aren't dropping in the street, even though it's so contagious. And when we first heard of the universal testing, we knew that those case numbers would be high. But if it were really any worse or deadly than the regular flu, the numbers would be much higher because it stays on surfaces longer and travels more than 5 or 6 feet. In fact, it's the universal testing that caused the panic. While the rate of deaths have gone down due to risk mitigation, cases are still climbing because everybody gets the flu, because it jumps around through rooms, travels in the air. Anyone who knows that to be true, anyone who knows that these risk mitigants are in place and it may not be as bad, is furthering the conspiracy to cause panic. Panic peddling is technically against the law. I don't want my kids to feel that constant panic, like people they meet may or may not be carrying a deadly disease, or their friends are. Could you imagine? So who decides if we shut down the world until a cure or vaccine is developed? Do we lock down every year now for the new flu strain? Now, it is also fair to say that it's not too much trouble for everyone to just wear a mask during these hard times, but where does it end? As we in the equity field believe it's fairness and impartial. If it's a bad flu, please wear a mask. But when does it end? If wearing a mask for the flu, then why not the flu for the next flu? And in that case, why not wear it for months when you're coming into the peak flu season? And why not wear it for the months coming out of the flu season? Just to be careful. For that matter, it sounds like we'll be wearing masks about 9 months out of each year to be careful and courteous to one another. Then that is 3/4 of our lives. How friendly and how open to friendships will our children be if they are trained to believe that every person is a threat or an illness to their health? And even worse, someone also might be a radical extremist because they are knowingly putting others at risk, even grave risk. So is it fair for me not to walk around sharing my views with everyone else because they have every right to be careful? At what point is enough enough? And who is the one who decides when is enough? Should I trust that my government will eventually realize that we're all safe, we don't need to wear a mask anymore? Or should I have trusted them in the beginning to do a fair risk analysis and make the right call for the betterment of all of our society? And if it is time to say something, what do we say about those who don't say something? Who is going to be the first to stand up and say not only is it wrong to make me wear a mask, but it is also wrong for you to wear a mask and look at me like I'm the problem? If I am representing risk to you, then stay home. Amazon.com delivers everywhere, even groceries, and your work will allow you to plug in wirelessly from the internet. And if you don't speak up, or if I don't speak up, who will? If all of us just stand by, then it will continue, and our new normal, as they call it, will be that all of our children suspecting of one another for being an infectious disease spreader, or as some news networks are saying, a super spreader. Will humanity ever treat itself the same if our kids are growing up thinking everybody is a risk to them? And is this enough struggle for us to stand up and rise against something being forced into a position of treating each other like we are all filled with a deadly disease and our kids learning to be that way? I want my kids to make friends. I want my kids to be able to walk into a room and smile and feel what someone is seeing them smiling. I also want my kids to have the confidence and the joy in their hearts to smile because they don't feel controlled and bridled, because the true achievement of happiness is found in the freedom to find it for yourself. Have our freedoms been taken, or at least infringed? When is enough? And who will stand up? So I walk around like an a-hole, like Keep It Real Tom, hoping people will realize that enough is enough.